We are going to start with some information about our pelvic anatomy. Here is the pelvis in a side-on view. You can see the base of the spine to the left of the picture and the pubic bone to the right. Inside the pelvis sits the three pelvic organs: the bladder at the front behind the pubic bone, the vagina and uterus in the middle where your baby is growing, the rectum at the back. The pelvic organs are all suspended in their position by a complex network of ligaments which you can't see in this picture. They are also held up by a very important muscle, the pelvic floor. This runs along the bottom from the tailbone to the pubic bone. During pregnancy, the pelvic floor muscle can become weakened due to increasing weight from the baby and amniotic fluid, causing an increased downward pressure. Combined with an increase in stretchiness of the ligaments due to pregnancy hormones, you are more exposed to having a prolapse. A prolapse is when one or more of the pelvic organs drop from their normal position. You may feel this as a bulging feeling in your vagina, most likened to a tampon coming down. Whilst we cannot affect how stretchy the ligaments are, we can increase the support from below by increasing the strength and bulk of our pelvic floor muscle through pelvic floor exercises. The other symptom commonly experienced by pregnant women is stress urinary incontinence. This is the involuntary leakage of urine with any activity which increases the pressure in the tummy, such as coughing, sneezing, movement, or exercise. This pressure is forced down through the bladder. The pelvic floor should react to this by squeezing tightly, closing up the urethra and stopping urine from escaping. But if the pelvic floor is too weak or slow or doesn't have good enough stamina, urine can be forced out, resulting in a leak. So again, strengthening the pelvic floor can help manage and eliminate this. Thank you for listening. Please now watch the video on red flags during pregnancy.